X-rays have long been used to diagnose osteoarthritis, but the evidence now tells us that they're not essential or necessary. So in today's video, I'm going to go through 6 reasons as to why we do not need X-rays to diagnose osteoarthritis, and make sure you stay tuned until the very end of the video, as I'll be giving you one reason in particular as to how they can actually make things worse. And I'm going to start right now. The first thing to note is that osteoarthritis is a normal part of the aging process. As we get older, the cartilage in our joints changes. So it does look slightly different when we're 50 years old than it did to when we're 20 years old. Now granted, some people do get pain with arthritis and some people don't. But there are a multitude of factors as to why we get pain. There have been a number of different studies that have x-rayed people that have joint pain and people that don't have joint pain over a certain age. And both populations of people demonstrate arthritic changes in their joints. Which means that if we x-ray anybody over the age of 40, more or less, we know that there's going to be some arthritic change on their x-ray. So we have to question how helpful that really is. Reason number 2 is we know that scans correlate poorly with pain. And if you have watched other videos in the arthritis series, you may have heard me say this before, but we know that individuals that have high levels of pain can have quite mild arthritis on an x-ray, and we know that individuals with hardly any pain can show quite significant osteoarthritis on an x-ray. Now, one of the main reasons for this is because pain is very complex. Now, pain is essentially controlled by our brain and our nervous system, and our nervous system reacts to many different factors. It does react to physical factors, but it also reacts to psychological and environmental factors as well. So if we think about the physical factors, we're thinking about things like being overweight, having a broken bone, having an irritated nerve. We know that these things can be painful. But we also know that psychological factors like stress, worry, fear, anxiety, mood, depression. And we also know that environmental factors like sleep hygiene, nutrition, exercise, work, relationships, family, bereavement, the list really does go on. But all of these factors can have an impact on our nervous system and subsequently our pain. And because there are so many different factors that can affect the amount of pain we experience, the pain that we get from arthritis is always a very individual experience. And it goes some way to explain why some treatment options work for some people and they don't work for others, and vice versa. But it also goes some way in explaining why pain correlates poorly with scans. Reason number 3 is that whether you have an x-ray or not, your treatment plan is very unlikely to change. We know that for the majority of people, we're going to try a conservative treatment plan first and try and avoid more invasive interventions like injections and surgery. Now, a conservative treatment plan would look a little bit like concentrating on activity modification, exercise, weight loss if necessary, and maybe a few adjuncts as well. So things like heat, ice, medication, manual therapy if appropriate. And for a lot of people, this really does help to reduce symptoms and get the outcomes that you're looking for. I'm interrupting just for a second to say if you would like to know more about osteoarthritis and all other things pain and rehabilitation, hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you very much for watching and enjoy the rest of this one. It should also be mentioned that this conservative treatment plan needs to be done for a long enough period of time in order to give your body time to adapt and change. So we're really looking for a 12 to 16 week period of that conservative treatment. And then if at that stage you haven't reached a level of function that you're satisfied with, it could be appropriate to have an x-ray. But at this stage, it's not that the x-ray is going to diagnose the arthritis because we already know what you've got. It's more an indication of whether you need further, more invasive interventions. Reason number 4 is that if you were going to have a scan at the beginning of your treatment and at the end of your treatment, it would look exactly the same, if not slightly worse, because you're slightly older. Even if you see an increase in your function and a decrease in your symptoms, which is again another slight example of how scans correlate poorly with pain. Reason number 5 is that your healthcare professional should really be able to diagnose osteoarthritis. I, like many of my colleagues, have spent many years working out how to treat and diagnose different conditions. Now, all jokes aside, there are a certain number of specific questions and tests that we can do for you that will help us diagnose osteoarthritis. In addition to the fact that it is an exceptionally common condition, which means we see a lot of people with it. It would be very rare for me to have a day in clinic where I don't see somebody with osteoarthritis, which means that we are pretty well placed to help diagnose it. Now, I did say if you stay tuned until the end of the video, I would tell you how and why X-rays could actually make things worse. Now, I know that might sound strange, but we do know there is evidence to suggest that people that have X-rays for knee pain or MRI scans for back pain tend to have more days of disability, more days off work, and can experience higher levels of pain. And for me, this is why it's so important for people to have a good understanding of when scans are and aren't appropriate. And unfortunately, there is still large pockets of the healthcare industry that are over-imaging people and over-scanning people despite the evidence. And we have to ask ourselves why. Now, I do think this is probably more prevalent in private healthcare settings than in public healthcare settings. But I was listening to a podcast recently from the guys at Empowered Beyond Pain, who cover all things back pain. If you've got back pain, do have a listen. I'll pop a link to their podcast in the description below. But they were highlighting the fact that there was some research recently that suggested the biggest indicator of whether you received an X-ray or not in the USA was whether the referring clinician owned the X-ray machine or not. So I think that gives us something to have a little think about. Now, rant over, back to how X-rays can make things worse. Now, if we're in pain, it's very normal for us to want to validate that pain by having a diagnosis or being told that we have something wrong with us so that our pain has some meaning. But if we are given a diagnosis, it's really important that we also are given the time in order to spend educating ourselves with accurate, honest, genuine information that's going to give us the power and the independence to manage that condition by ourselves. And unfortunately, time is not always something that clinicians have a lot of. And your thoughts and your beliefs about that condition have a very big impact on what happens down the line. And we know that typically osteoarthritis is deemed as this degenerative condition that's gradually going to get worse as we get older, and there's not a lot that we can do about it. We know that this isn't the case, and there is lots you can do about it if you get the appropriate help. But having these negative thoughts, feelings, and emotions can lead to doing slightly less because you don't want to make the condition worse, exercising less, walking less, generally doing less. All of the things we know are bad for osteoarthritis. The last thing I'm going to say with regards to how X-rays could potentially make things worse are scans often lead and are more likely to lead to more invasive interventions. Unfortunately, what happens a lot of the time is you have an X-ray, it comes back and it says that you've got arthritis, which we knew already, but then you get referred to an orthopedic surgeon for either an injection or a surgery without trying the conservative methods of treatment first. That could work. And it is estimated that 1 in 3 people have a joint replacement that they don't actually need. Thank you very much for watching. I do hope you've enjoyed today's video. There are some useful links below the video in the description to help you manage your arthritis better, and I would love to hear from you. So do drop me a comment below the video and let me know if you've had an X-ray and tell me how that made you feel and whether you were educated about it or not. If you are new to the channel, then please do hit that subscribe button so you get notified every time I release a new video, which I do every single week. And if you're feeling very generous, then you can hit the like button whilst you're there. If you have enjoyed this video, you may also like the video that I have put together on knee arthritis exercises, and there is a whole playlist on the channel to help you manage your arthritis better at home. Thanks again for watching, and until next time, I will see you again very soon.